welcome everyone to this webinar. So my focus essentially will be on looking at the effects of COVID-19 on African economies. And then where we can is to draw lessons from Zambia by pointing out the kinds of economic strategies that were employed and deployed to address the COVID-19 pandemic. So my presentation outline is as follows. We try to look at the status of COVID-19. We'll look at the numbers and how that compares for Africa and the rest of the world. Then we'll move on to look at the general impact of COVID-19 on Africa in terms of trade with the rest of the world, its impact on commodity prices, travel, and tourism. So when we'll be looking at the status of COVID-19 in terms of numbers, I think that's the health effect of COVID in terms of actual cases, recoveries, and deaths as well. Then we'll look at the situation of Zambia in terms of, which is basically what has been done in pretty much every sphere of the world in looking at the impact of COVID-19 on Africa and the kinds of interventions that have been promoted by different countries, which include social, public health, and economic policies. Next slide, please. So if you look at the numbers, in Africa alone, there are 47 African countries that have been affected. So the 47 there that you see in terms of numbers is for Africa, and the cumulative cases are over 1.3 million actually. If you look at the WHO region, it shows over 1.4 million in terms of cases. But Africa's only experienced 24,000 deaths. But if we look at the global scale of infection, it's over 54 million confirmed cases that have been reported to WHO as of yesterday at 3:33 p.m. With over 1.3 deaths. So the number of deaths across the world is almost equivalent to the cumulative cases that have been reported in Africa. So what we do observe from this scenario is that there are variations when you consider different places, but Africa seems to have miraculously been insulated from the pandemic effects in terms of the scale of infection and the resulting deaths. Obviously, these numbers keep changing because of new infections every day, new recoveries, and new deaths being reported. So let's move on to the second slide, please. Next slide, please. So in order to understand the impact of COVID-19 on Africa, so obviously we understand from the point of view of the public health impact of COVID-19, which has involved infections, debilitating effects of COVID-19 itself, and as well as the impact, the fatal impact in terms of deaths that have been reported. But what about the impact of COVID-19 in terms of economies of Africa? So the way in which we understand what's happening to Africa as a result of COVID-19 pandemic is to first understand how deeply integrated Africa was before COVID-19. So as we know, the level of integration of Africa with the rest of the economy is quite deep. It shows a substantial export dependence on the continent. So total trade from Africa to the rest of the world was around 760 billion for 2015 to 2017 period, which is quite high, but we can see that trade of Europe, the rest of the world, is more than 5 times what Africa is exporting to the rest of the world. The share of exports of Africa to the rest of the world ranges from 80 to 90% between 2000 and 2017, which is really a reflection of the high dependence of African trade on the rest of the world. But if we look at intra-African exports, it's only 16% of the total exports for the year 2017, compared with Europe within itself, which is exporting around 68%, and then over 55% in the Americas. So intra-African trade, which we define as the average of intra-African exports and imports, was only around 2% during 2015 to 2017%. But then if we comparatively look at what other regions are doing in terms of trading within themselves, we see that they're substantially higher than Africa. So China turns out to be Africa's largest trading partner, over $200 billion worth of trade with the continent. Next slide, please. So what are some of the interventions that have been mounted in order to address the COVID-19 pandemic? So we see that what some countries have done, China, for example, is to close some factories and workplaces in general, to impose restrictions on travel, which has involved suspension of international flights, sometimes even movements of people domestically. So lockdown measures have been put in place across the world. So this is interventions that have been put in place in order to mitigate the spread of the coronavirus. So the immediate effects of these interventions has been disruption of trade flows, a contraction of global output as we can imagine. So reduction of consumer spending, the weakening of global demand for African products, scale of these products ranging from oil, cocoa, tea, coffee, flowers, or even copper for Zambia, for example. We've also seen decline of tourist numbers on the continent, obviously directly related to restrictions on travel. Then there's a slowdown of economic growth anticipated. For example, Zambia is projected to contract as much as 5% by the end of 2020. And then there has been concomitant rise of unemployment and substantial sectoral variation. So depreciation of African currencies as well. The kwacha, Zambian currency, has depreciated by more than 50% within just a couple of months since the COVID-19 pandemic hit the continent. We also anticipate global and continental recession. Next slide, please. If we look at what's happening in Zambia, so what we try to do is at least just look at the trade balance for Zambia. We've seen that for the second quarter of 2020 compared to the corresponding quarter in the previous year, we see a 14.5% reduction in terms of export earnings. We see a decline also in terms of imports. So this seems, in a way, to suggest that there's been an improvement in trade balance, but this is really superficial in the sense that it's directly related to disruption of trade flow due to the restrictions that have been imposed, and rather than real positive effects upon these economies. In Zambia, the business survey that was done very recently did show that there's been reduction of business revenue. We've also experienced employment cuts as well as changing business operations. And then a range of interventions have been put in place by the government. Next slide, please. So what we have are infection prevention and control, which are related to social and public health policies across the world. And in Zambia in particular, we had social distancing measures put in place. And in more formal settings, you observe a situation where there's more, the distance between people in particular space, restrictions in terms of number of people that can enter particular enclosed space has also been enforced. There have been lockdown restrictions on movements, remote working and learning, shifting of hours. We've seen also public health interventions such as hand hygiene, use of personal protective equipment, cleaning and disinfection of equipment and different environments, as well as resources being dedicated towards enhancement of test kits and self-quarantine in events that you have been exposed to a person who's had COVID-19 pandemic. Now, to address the economic effects of the COVID-19 pandemic, we see a combination of monetary and fiscal policies. The central banks in different countries, in Zambia, for example, today, the Bank of Zambia just announced that it's going to keep its monetary policy rate at 8%, which was a reduction by 1.25 percentage points 3 quarters before. So the central bank has used the monetary policy rate and instituted or put in place what we call the COVID-19 stimulus package, as well as measures to address the foreign exchange fluctuations, as well as inflation control. So essentially, this has been to boost liquidity position in order to stimulate aggregate demand, to counter the effect of the COVID-19 pandemic. So fiscal policy as well has also worked around activating or stimulating aggregate demand through offers of tax relief and other tax incentives, such as zero rating certain products, especially medical supplies, in order to strengthen the public health position, but also to ensure that business activity continues. There have been subsidies that have been provided in certain businesses. For example, the tourism and hospitality industry has received a host of subsidies and supports from governments in order to boost economic activity and fight the effects of COVID-19 pandemic. Next slide, please. This is my last slide. So what I wanted to point out is that all these things for Africa are also happening within the context of rising public debt for most African governments. So Zambian government, for example, itself has mounted a series of interventions and towards debt restructuring, and has gone on to have discussions with international partners, the creditors, as it were. And we know there are initiatives such as the Debt Service Support Initiative that has been put in place in order to help African countries to fight the effects of COVID-19 pandemic. Incidentally, this is meant to focus on the vulnerable section of society, as well as public health and social interventions that can help to safeguard lives of the vulnerable section of society. Now, the opportunity is here for civil service actors to speak on behalf of the vulnerable, to help strengthen institutions to fight misappropriation of funds meant for COVID-19 pandemic. So there are reports, for example, in Zambia that substantial portions of COVID-19 funds have been misappropriated. So there is an opportunity for civil actors to speak for the vulnerable, to ask for strengthening of institutions during this time. But there's also an opportunity to speak to international creditors to allow for more fiscal space so African governments can more effectively fight the COVID-19 pandemic.